This is a subject very close to my heart and to many other people's. We talk a lot here at the conference about the advances we've made in research and about a bright, promised future. But the reality is that inequality is probably one of the biggest threats to having those advances realized. And it's extraordinary, really, because there's nothing really new in the sense that we know the inequalities exist. Ever since the Committee on the Social Determinants of Health and Michael Marmot, we've known across Europe and across the world inequalities are bad and they are growing. Europe's actually a very good case in point in all this. And we know from the data out there that where you are born and where you live in Europe makes a massive difference to whether or not you get cancer, and then if you do get cancer, how well you do. And the data that's already been presented at this conference, for instance, shows across Europe, in something like testicular cancer, the difference in 5-year survival between the best performing and the worst performing countries is 28%. That is an absolute shocker in this day and age. Even in something like breast cancer, very good guidelines, very well networked, really we know how to treat breast cancer. The difference across Europe is 18% between the best and the worst performing countries. And it goes beyond this. I think it's not just a failure in a sense of our systems of care and the issues around our systems of care. It's also a failure in preventing cancer in the first place. And Mark remarked about the issue here in Austria in not prosecuting tobacco control laws. In Sweden now, only about 1 in 10, about 15% of men smoke over the age of 15. If you look at Greece, Lithuania, Bulgaria, that figure is 55% of the male population. That is not a failure of individuals, that's a failure of political will to control tobacco in those countries. And that is a standing inequality within the public health system. Standing back, the question for everybody is, what on earth do we do about these inequalities? Well, the first thing is that, generally speaking, for cancer care, you need a strong, well-funded healthcare system per se. And the reality is, and the message must be to politicians in many EU countries, that health must be one of the first areas you invest in, along with education and employment. And if you don't do that, the actual benefits of developing a cancer care system will not be realized. And what we've seen over the last 10 years, and particularly in the more vulnerable Central and Eastern European countries, in less and less in terms of total healthcare expenditure. The second issue is about prioritizing cancer. Cancer actually magnifies all the strengths and weaknesses of our healthcare systems. It's one of the most complicated. It does cost money, and it requires long-range planning. And in many countries, one of the problems with the inequalities in outcomes is there isn't the transparent governance and long-range planning that's required. It's very easy to speak to this from a UK perspective, where we have national cancer plans, we're very open, there's lots of public scrutiny, inquiry into progress, a lot of angst about how well we're doing with our outcomes. This is just not reflected in many European countries. It is not transparent, it is not open. Public officials and political officials are not held to account for improving patient outcomes. And I think it's absolutely superb. We're having this drive now to focus on disparities, because it is about actually making sure the research we do and what we already know helps improve patient outcomes. So I'll stop there and thank very much indeed to the panel here and hand over back to Mark.